Hi, in this video, I'm going to be talking about the different types of therapy that's available to you if you have anxiety. Hello, my name's Wahida Finley, and this is part 10 of the 10-part video series that I've created all about anxiety, called Anxiety Unlocked, where I teach you all the things you need to know about anxiety and how you can get better. So in this episode, I'm going to be explaining just the different types of therapy that you can get. So you probably heard of CBT. That's the most common thing that the doctor's going to prescribe, or NHS is the option. They're going to give you CBT, which is cognitive behavioral therapy. And that's where they're going to look at all your symptoms, and they're going to help you manage your thoughts, manage your emotions, and try and change how you feel. So they are just working predominantly on your symptoms, and you're always going to have to use these techniques. So they're grounding techniques and distraction techniques. They do exposure therapy as well. So it doesn't actually make anxiety go away. It's just doing coping mechanisms to help you in that moment in time. So if you manage to alleviate your anxiety symptoms today with CBT techniques, tomorrow you're going to feel it again. You're going to get panic attack again. You're going to get anxiety again. And this is absolutely how it works. So people say usually it's good for some things, but it's not going to be a permanent solution, because you're always going to have to manage these thoughts and emotions in that way, and you'll always get anxiety the next day or the next time you're presented with it. So that's not a long-term solution. One of the other things that you can get is medication. So typically you might get sertraline or citalopram. You'll get medication from your GP that will help you. So I'm not against medication. It will help you for a while. It will calm down your symptoms. But again, it's not going to make anxiety go away. It's always going to be here whilst you're taking the medication. And after a while, some of the medication will stop working, because your body will just get adjusted to it. It can leave you sort of balanced. It will balance you out, but it will leave you not be super happy, and it won't allow you to get really low either. So it's like a numbing effect. So people sometimes feel like they're a zombie. They can't get emotional. They can't get their emotions or feel good about anything. So that's typically what it does. The other thing that some of the medications do is it mimics all the symptoms of anxiety anyway. So you can get heart palpitations, you can get dizzy, you can get nausea, you can get vomiting, and sleeplessness. So the medication are actually creating anxiety type symptoms as well. So sometimes you need the medication, and if you are feeling really, really rough and you need it, then please take it until you can get some therapy. So when clients come to see me, some of them are already on medication, which is fine. But then a lot of the time they just stop. When we've done the therapy and we've let go of anxiety and you stop having anxiety, then they're able to come off their medication. But that has to be agreed with your doctor. You have to be reducing, and you have to, manage program. You can't just sort of stop your medication like that, because you won't feel very well if you do it. So I don't recommend anyone to stop their medication cold turkey. You have to get approval of your doctor. Even if you've had therapy with someone like me and you're feeling better already, lots of my clients stop medication, but they do it with the doctor's knowledge and in a controlled way, so you don't get ill from it. Okay, so that's that. You could see a psychologist or psychotherapist where you're going to analyze your life. You're going to go back in time and you're going to talk about things that have happened in your life. You can have counselling as well from a counsellor. So they're very similar things, but they were literally going to analyze things that happen in your life, upsetting things, and you're going to go through what's happened. Sometimes it's raking up the past. So you're going to go and cry about it, get upset again. And every time you go, your therapist is going to ask you to describe feelings and what happened. So I find that counselling can be re-traumatizing. A lot of my clients just don't see any benefit from it. Counselling is great if you've got relationship problems or if you've got grief. It's really good to help you with grief, and you need that to sort of manage how you're going to cope through life and your new life without this person. But to make a panic attack go away, to make anxiety go away, counselling isn't going to make it go away. Just knowing that something bad happened. So for example, if it was a rape or something like that, if it was the trauma in that way, just knowing that we know it happened, going to talk about it isn't going to make your involuntary response in the brain completely go away. You're just going to talk about it, cry about it, you might come to terms with it or change how you feel, but your brain will still spike that fear. Your heart's still going to beat fast. You may have heard about a method called EFT, which is emotional freedom technique, which is tapping. So tapping on points like this, where you access meridians in your body, which are energy lines. And these are the energy lines, the energy points that we use for acupuncture, acupressure, for Chinese medicine. And they've realized you can tap on these points and it will send signals to the brain and you can change your feelings. So although I'm trained in it, I don't actually use this as part of my method. I would if someone was really distraught and too upset to even do hypnosis or do the therapy, we can do that. Or if they're away from me, people have contacted me when they're like in the middle of nowhere on a boat, or they're driving and I'm driving and please help me, I'm about to do this, or something like an emergency and I'm not around. I may send them a video of it and they can just tap on their points to help calm their own self down. But it's not the method I use to get rid of it. It's just a method that can help shift your emotions really, really fast. It can help with pain as well. So it's very strange. You can tap on these points and say specific things, and even the pain in your body. Like I've had clients come in and they've got a pain on their shoulder. So they're not focused on what I'm saying when we're about to do hypnosis. And I know they're focused on that pain. And I said, we're not going to get good therapy done if you're just thinking about your shoulder. So we've done a bit of tapping, or we've done another method, an NLP technique to get rid of pain. And when that pain has shifted to like 0, they go, oh, I can move my arm now. And they're like lifting their arm up, and we know. And it's really, really obvious with EFT, whether it's emotions or physical pain, when you tap, that it can literally be reduced. The headache can be reduced and the pain can be reduced. And then we do the real therapy. So I wouldn't say that emotional freedom technique is a great super method or the method to release trauma. That's not my experience with it. I'm trained in it, I've used it, but not to get rid of panic attacks or not to get rid of anxiety permanently. It's okay to manage a situation where you're about to go on stage to present something, or you're about to go on a flight and you just want to calm down a little bit before you go on. And if you hadn't had therapy before, some people like to do it and it makes them feel really good. But I wouldn't say it's ideal for trauma release or to stop panic attacks from reoccurring or anything like that. So I wouldn't say it's a permanent method. That's just my opinion. There are therapists that are just trained in that and they just do that all the time and they use it for everything. So, you know, be open to what it can do for you. But I just use it as a little mix with some of the things I do just to help people out if they need it. Now I'll talk about hypnotherapy. So hypnotherapy is one of the methods that I use. I use it in a couple of the sessions I do in my 4-week program. And there are lots of hypnotherapists around. We all do different things. We all work in different ways and we're trained in different ways as well. So there's something called solution-focused hypnotherapy, where they're actually just trying to make you feel good or put positivity into you and things like that. Now, I don't do that because it's like masking what's really there. It's hypnotherapy without actually fixing the problem. So you're just trying to feel good. But if you're like traumatized because of something, just telling yourself you're happy and joyful and positive isn't going to make it go. So that isn't what I do. And also another type of hypnotherapy some people do is called suggestion hypnotherapy. And lots of people do it. Lots of hypnotherapists do it. So you just lie on the couch and you're going to close your eyes, and the hypnotherapist is going to say nice things to you, or they're going to tell you, you will feel good, you will feel calm, you will sleep well tonight. That's okay with a recording, a hypnosis recording. Audios, that's what we use it for, because suggestion therapy, it's like having a meditation and getting told nice things and then you go. So that's not something that I do in my therapy practice at all. I don't do that sort of hypnotherapy. Some people say to me, I've had hypnotherapy and it hasn't worked. And then I find out that they've been going to a therapist, a hypnotherapist, and having suggestion therapy where they're just getting told nice things all the time. You will feel this, and they just lie there in silence, getting told nice things by their hypnotherapist, and then they open their eyes and go home. So that is just like a meditation you can get on YouTube. You can buy audios. I do audios as well, but that's to help you at home when you don't have a therapy. It's not the actual therapy, it's to help you. It's not to replace proper therapy. But unfortunately, some hypnotherapists, that's the only therapy they do. That's what they think hypnotherapy is. And if someone presents with anxiety or like binge eating or something like that, they would do these suggestions to make them not want to eat things and make it not taste nice and things like that. And that's not dealing with the issue, because you might be binge eating because of some sort of childhood thing, or a parent died or something like that. So there's all sorts of reasons why, and I prefer to deal with the reason. So I'd rather deal with the reason, and then my clients get better. If we're just going to give suggestions about things, we're not actually dealing with the fact you saw a dead body or got bullied at school or anything like that. So suggestion hypnotherapy is great for audios, it's great for meditations, it's great to help you sleep. If you want a hypnosis audio to help you sleep, I have those, I do that. I've got hypnosis audios for confidence, for self-esteem, to stop your jaw grinding. So these are called suggestion scripts and suggestion hypnotherapy, and we tend to do it on audios. I personally don't do it in person, because there's more life-changing things that we can do when we're in therapy. So a hypnotherapist like me, a clinical hypnotherapist, we're going to work on the thing that happened to make you feel the way you do. So to make you scared of things, if you've got trauma, if someone's died, a relationship broke up, you've been bullied, your dog died, your family died, abuse, rapes, all sorts of things like that. So grief, we help with those relationship breakup, traumas, physical abuse. When I hypnotize anyone, it's to deal with the things that's happened in their body, in their brain. We don't spend time dwelling on it. So I'm not traumatizing you, making you cry about it. We're just going to help you release it at a brain level in hypnosis, which means your subconscious mind that's holding on to these things can just let it go, and then you're better. So, part of you wants to eat cake, and part of you wants to punish yourself, and part of you wants to be slim. So we do these things called like parts therapy, for example, is what I use if someone has got an eating disorder. So suggestion hypnotherapy isn't ideal. There are many sort of rapid techniques, therapeutic techniques where we're actually creating change with hypnosis, and not all hypnotherapists do that. So that's part of the thing that I do in my anxiety gamma brain reset method. Has got a bit of hypnosis. It's not all hypnosis. I use brain techniques and other things as well that activate both sides of the brain, but I am using some hypnosis as well. Hypnosis is profound, it's really deep, it goes to the subconscious level, things that you're probably not aware of, so we can make permanent change. One of the other methods that I use is called EMDR. So I'm trained in EMDR. There is another method similar called IEMT. I use a mixture of eye movement techniques. I think it's about 4 or 5 different eye movement techniques that I'm trained in. So I've combined them into my gamma brain reset program. So we're accessing parts of the brain that are holding on to traumas, holding on to bad memories that hurt you, upset you, frightened you, whatever it is. And we're able to let it go by accessing parts of the brain. We move the eyes in left and right, side to side, diagonal, all of that. And when we do that, we're activating both parts of the brain, and it will neutralize it to 0 really, really quickly. Now, we use that for people that have been in car accidents, police, social workers that have seen dead bodies and things like that. So eye movement, EMDR, IEMT are really, really good methods for treating trauma. I've combined it, I've incorporated it into my anxiety gamma brain reset method. There is quite a bit of eye movement methods in there. And that helps people get rid of anxiety, panic attacks really fast. I even use it for my 90-minute phobia session. So you've probably seen videos of me out and about doing a 90-minute session where I'm driving with people, getting in lifts, getting in cars, and they're free of their 15-year phobia in just 90 minutes. The reason why I can do that is I'm using a bit of hypnosis, I'm using some other methods, but one of those methods that I use actually is eye movement. So you can do that quickly, get rid of the fear in your response in your brain, and you're able to just jump in the car and let's go. Whether it's on video and checking with me, FaceTime on the phone, people do that because they're not always in the same country as me, or I'm with them sometimes in the car, in the lifts, or wherever we're going to go, on the top of a building and stuff like that we can do. But the eye movement literally changes how people feel. So there's so many different brain techniques, and some of the methods that I use to activate the brain, we're using both sides of the brain. It's called bilateral brain stimulation. It's not just moving things around. Some people show you like moving a pen around like this. No, I don't really do that. I don't even know if that works, but that's one of the methods I got taught. No, that it's actual methods where we're going to get protein synthesis in the brain when we think about something, and we're going to neutralize it with different forms of eye movement in our body. So it's hard to explain because I'm using like nearly 13 years of experience of using lots and lots of different techniques on thousands of clients I've helped with anxiety. But if you want to know more about how I treat anxiety, on my website there is a services page, and you can see the different ways you can work with me. I've made it really affordable for people. Everyone's at different stages. Some people want therapy, some people are not ready for therapy. They're just like curious, and how can I get better? I just want to feel a bit better. I've got a bit of stress, but I don't have panic attacks. So I've got different things for different people that I can help you. I am an anxiety and panic attack specialist, and that's what I do. So for example, on my website, there's an audio for reducing anxiety. It's a hypnosis audio. I've been using it for about 12 years in my therapy practice. It's the most downloaded audio I've ever had. I've sold it to people. I've actually given it to people as part of my private clients. People that have my anxiety program, they get that. So I've made it available for sale. Just one little audio on its own, it's only $14.99, and that just changes how you feel. So it doesn't replace therapy, but when you're at home, it helps you to sleep, it helps you calm down your thoughts, it helps you to feel really good. It just shuts out negativity of the day. If you've had a stressful day, it will just help you, wind down. Or you can start the day in a good way as well. So that's one way. I've got another way, which is I've recorded a full hypnosis session where you are going to actually let go of things in your mind that you choose to let go of. It's called content free. Quite a lot of the work that I do is content free, meaning that we're not going to pick all the things that happen in your life in that way. You're going to choose in your mind what you wish to let go of, and you can do that in multiple ways. And I do quite a few sessions like that. So I recorded one session for you, one whole hypnosis session, which is like a good cleanup of your life. It's called a mind detox, to help you unburden all the things that are holding you back or keeping you stressed. That is available on my website, as well as a 1-hour session, as if you were here with me. So it's cheaper than having therapy because I recorded it, and you can watch it on video and close your eyes and just get therapy without having to. And it's proper therapy. It's not suggestion therapy. It's proper therapy, and you would feel really, really good. So that's another stage. That's only £97. So if you wanted to do that, and you don't have to see me, you don't have to go to a therapist. You can do that at home. And then another way is I do the anxiety gamma brain reset methods. I do it in person, and I do it as a recorded version as well. I've made that affordable as well. So if you can't afford therapy and you don't want to see anyone and you just want to stay at home, I have recorded it and have made it in such a way using even more methods and more sessions than I give in the real person, in the in-person therapy. The online program has more things in it because you're doing it on your own. You're watching the videos, you're doing the therapy as if you were here with me, but I'm not working on your specific things. You're doing it, and I'm guiding you and helping you in each session through that. So you can work at your own pace, and that's a pre-recorded Gamma Reset program. Is all there for you with extra bonuses, and it's got the other bonuses as well that I've provided for you. Or you can work in person, so in person or on Zoom. I do the anxiety Gamma Brain Reset method in person. It takes 4 weeks to do, and we can work on all of your specific issues as well. So if you want to find out more about that, there is more information on my website. You can just click on there and find out about that. And I talk about that in detail, what's involved in that and how that can help you feel better fast. So I hope that's given you some understanding about things. For example, not everyone is suitable for this type of therapy. I don't treat children. If you've got psychosis, for example, this isn't suitable for you. You may just want counselling. Like, I'm not a counsellor, so if you want someone to talk to and you want someone to talk about your feelings, then you need counselling. That would be the best thing for you, and it isn't what I offer. You know, I'm sympathetic, I care about my clients, I want them to feel better, and I do, after I've cleared all the negative stuff, I do put nice positive reinforcement in to help them build up their lives, to help get rid of depression, to make them feel happy and confident, help them go back to work, to help them go out in public. I only do that after I've cleared all the traumatic things. And I found it's really, really fast. This is why a rapid method, it only takes a few weeks. And that program that you see me working on all these clients is equivalent to like 6 months of therapy. Like, some of those clients have actually done a whole year of therapy, a year of counseling, 6 months of hypnotherapy, or 6 months of CBT, or they've done multiple CBT, usually done in 12 weeks. So they've done a couple of 12-week sessions with their CBT therapists, and they're still not better. 12 weeks here, 12 weeks there. If you imagine paying for all that therapy and still not better, we're working at a brain level, a subconscious level, and releasing these in different ways. And the anxiety and the panic attacks don't actually happen anymore. It's gone permanently. So check out my website, check out some of the reviews, and you'll see how good it really is. I've been doing this for nearly 13 years now. It's 2023 now, and it's been 13 years I've been working with anxiety and panic attack clients. It's what I specialize in, and all my clients have it. So I would say I'm very good at it, but you can check out my reviews and make your mind up for yourself. When choosing a therapy though, there are lots of therapists that have just done it over a weekend. Hypnotherapy isn't regulated in the UK. Some people just do a weekend course, or they hardly do any classroom hours, and they think they can go and help people with trauma or anxiety and things like that. So just be careful about who you pick, whether it's me or someone else. I would be very, very careful about who you pick. Make sure they've got results. You want to pick someone that's got evidence, proof of their work. They've got loads of nice reviews on Google, or they've got videos like me of real people talking. If it's in someone's website colors saying they were great, I'm better, then it's really hard to tell whether it's true or not. So people get upset sometimes when they come to me. They've spent a load of money on therapy that hasn't worked. It doesn't mean that therapy doesn't work. It just means that they've chosen the wrong therapy for them. They haven't made wise choices on who they pick. They haven't researched their therapist or the methods that they're going to be using or what's going to happen. So if you pick a therapist without proof of work, then you don't know. And if you're just choosing the cheapest person you can get, thinking all hypnotherapists are the same, or we're all going to do the same thing, that's not true. We're not the same. We all work in different ways. You know, someone just might be telling you your anxiety is floating in the clouds and hope for the best, and someone else is treating the cause of the fear in your brain that's happening in your body, and to stop all of that happening. So that's what I do. So just be careful about how how you choose your therapist. Make sure that they are qualified, make sure they're registered with a professional organization, and that they've got proof. Okay. And then you can choose what's right for you, whether it's hypnosis, whether it's the type of, if you want change quickly, then obviously this is for me. The type of therapy that I do, you want to be better quickly, you want less time out of work. If you want long-term therapy where you're talking every single week for 6 months, then you need to find a counselor for that. So absolutely, that would be the best thing for you if you just want someone to talk to. Okay, so I hope I've helped you understand the different types of therapy that's available. If you've got any questions, you can book a call with me and we can have a little chat. Or if you'd like to work with me further, there's loads of information on my website, wahidafindley.com. Thank you.